In traveling around the world recently, I've noticed that there's a common consciousness developing where people are becoming proactive about their health and wellness. In the Pacific Rim, in Europe, in North America, South America, and the Caribbean as well. According to the New England Journal of Medicine last year, 34% of Americans opted for alternative health care and spent $52 billion out of their own pocket to do it. The headache industry is a $66 billion a year industry in the United States. The sleep disorder industry is a $128 billion a year industry. Fully 68% of all tractor-trailer drivers' fatalities that occur on the road today occur as a result of sleep deprivation. Truly, as you look forward and backward, 186,000 people last year died as a result of improperly prescribed drugs. Another 561,000 people in the United States wound up in intensive care due to drug interactions. I think it's time, don't you, that we look to the future. Actually, I think if we were to take this century and put it on videotape and move 200 years into the future and then retrospectively look back on this century, it would indeed be called the drug century. It's time to move on. Actually, this century, when looking at the genuine milieu of wellness throughout the past several thousand years, this century that's coming to a close will be dubbed the alternative century. It's time that we move on. What I'd like to do now is bring up before you a panel of 6 doctors to have them introduce themselves, tell you about their curriculum vitae, where they went to school, things like that, and their awards, and then share with you their thoughts as to why they would become involved with the Nikken experience. So, ladies and gentlemen, please help me in welcoming the doctors panel. We'll start on this end with Dr. Cangiano and then just move right across the board.
Hello, my name is Stephen Cangiano. I am a podiatrist. I graduated from the Pennsylvania College of Podiatric Medicine. I taught surgery at the New York College of Podiatric Medicine for 3.5 years, then ran and developed the largest residency for foot surgery in the state of New Jersey. I'm board certified in surgery, foot orthopedics, and I'm fellow American College of Foot Surgery and Orthopedics.
Hi, I'm Dr. Lawrence Bauman, sole practitioner in dentistry, Fanwood, New Jersey, co-author of over 15 textbooks, internship at Beth Israel Hospital, Manhattan, on the staff as an assistant professor at New York University Department of Oral Diagnosis. In practice in my 31st year of dentistry, treating some 4 generations of families right now.
Hi, my name is Robin Warshawski. I'm a family physician from the Greater Toronto area. I graduated from the Faculty of Medicine at the University of Toronto in 1978. Unfortunately, I entered medicine in Canada at a time of great insecurity for doctors because of our government health insurance plans. And so in addition to doing family medicine, I also have a large subspecialty practice. It's a cosmetic practice providing sclerotherapy and injection treatment for varicose and spider veins. In addition, I also do some non-clinical work as an examiner in the physician assessment program of the Ontario College of Physicians and Surgeons. That is, I get to check out how the other docs are doing.
Hello, my name is Stephen Greer. I'm a cardiovascular surgeon. I went to Kirksville College of Osteopathic Medicine, did my general surgery training at Grandview Hospital, my cardiac training at the Cleveland Clinic. Chairman of the Department of General Vascular and Cardiothoracic Surgery, Director of Cardiac Surgical Services. I am a flight surgeon, Lieutenant Colonel, Flight F-16 Squadron.
Hi, I'm Lisa Lakota. I'm from Dayton, Ohio. I graduated from Ohio University with the Dean's Award. Since then, I've specialized in both emergency medicine and pain management. I'm board certified in both. I'm on the teaching faculty of Ohio University. I'm president of our local Health Society, and I'm also on the Miami Valley Health Improvement Council in our area.
Hi, I'm Wayne Anderson. I'm a doctor. I'm the director of the Department of Anesthesia at Grandview Southview Hospital. I graduated first in my class from medical school, and I'm proud of that, and now I'm on a new mission.
Now what I'd like to do is ask each of the doctors to share with you from their very gut level why they got involved with Nikken, and also we polled from the audience some questions, and each one of the doctors will be answering one question apiece.
Why I got involved in Nikken was because I was not having fun in practice anymore. HMOs were regulating the business, and I was working harder for less. And what they've done is they've taken the autonomy out of it. What I was able to do is not treat patients the way necessarily I wanted to. I would have, for instance, someone, a nurse or a clerk in California, telling me how to treat a patient in New Jersey. And the long-term specter of working harder for less just was not exciting. The most common question that I've gotten is this: how do I approach a physician about this business? And what I say is this: the doctors like to talk what we call objective signs, meaning what are the facts and figures, like an X-ray is an objective sign. Well, the X-ray of medicine is that the business is changing, and it's changing dramatically. And so when I talk to a doctor, I says, I don't know what the future is going to be like in the business of medicine, but common sense prevails that you need to have a plan B. And in my opinion, this is the best plan B out there. Two things I want to add is this. I taught surgery for 10 years. I've helped more people more profoundly with these products than I did in 10 years of medicine. From the business side of this, as Dr. Boger mentioned, medicine is changing. It's a paradigm shift in terms of disease treatment to disease prevention. The opportunity doctors had 20 years ago treating disease is the opportunity we have in Nikken preventing disease. The magnitude of what they did is the magnitude of what we can do now.
As a sole practitioner in dentistry, we have seen many changes, especially in prevention over the years. We now have two generations of children coming in that do not know what it is to have a cavity filled. Recognizing the opportunity that we have in our hands right now and being aware of the preventive mode in healthcare, we looked at Nikken as a way of preventing problems. This is the most fantastic opportunity that we've seen. I have helped hundreds of people, probably close to 1,000 in the last couple of years, through these wonderful products that we have. A week does not go by, and almost a day does not go by in my office that someone doesn't call me to thank me for how they've been helped. I cannot explain the gratification and the feeling that one gets. We've been hugged, kissed, and blessed through these products. After practicing dentistry 30 years, 10 hours a day, we see this opportunity is helping more people in a total way than I can actually do in my practice. I happen to enjoy dentistry. I enjoy the interaction that we have with patients, but the fun, the personal growth, and what we have in our hands here to help hundreds and hundreds of people is just incredible. Most frequently asked question that we do get is, do I suggest or refer any of our products in my office? Well, when we know we've got something that is unbelievable, that can help people in all different areas, we cannot help but to express and come up with our products. As far as dentistry is concerned, we've helped people with jaw discomforts, but more importantly, I've seen patients come in that cannot stand up erect, that either get up out of our chair, holding their knees, having problems, yawning at 9 in the morning, maybe 5 and 10 times. And so we look at the total human being as a total entity, and we have products that help all of these kinds of people, and that has given us tremendous excitement.
Yeah, I guess my why for Nikken is profoundly personal, but if I can do it in silver training, I guess I can do it here. A number of years into practice, I began to feel that I was losing some interest in what I was doing, that I was kind of losing my passion and enthusiasm. It troubled and confused me, but I just began to feel this strong compulsion to go in another direction. I had other ideas, other potentialities that I wanted to express, specifically in the visual arts. I began to feel a little bit guilty that I was somehow perhaps betraying the society that invested in me, perhaps betraying my patients because I knew I wasn't giving them 100% anymore. And perhaps most of all betraying myself because I wasn't doing what I was really feeling deep within myself. I'd wanted to make a change. I'd wanted to maybe even drop the letters MD after my name, but I found that I really couldn't drop the income as well. But a year ago, I realized that to make a change was okay, that I gave myself permission to do that, and it was not only just okay, but desirable. I began to feel that, for me anyway, and perhaps for everyone, change is necessary to grow and develop as a human being, and this was important. And so for me, Nikken is a mode of transformation that will take me from being an MD, a mere doctor, to what I truly aspire to be, which is a very highly creative individual. One of the questions I get asked most frequently is how these products actually work. And what I tell people is that I don't know. I don't know how they work. As a family doctor, I deal with that kind of uncertainty every day in conventional medicine, where some of the therapies, and particularly pharmaceuticals that we use, just have no known mechanism of action. I point that out to people. I point out to them what they really want to know is if they work and if they're safe. And I tell them that the pharmaceuticals certainly don't always work and they're certainly not always safe. And I point out to them that no patient has ever in 20 years asked me how the pill works. What I tell them is that what I think they're asking is, when they ask me how these products work, is that they're trying to think themselves into some kind of belief about this stuff. And I tell them that if they really want to be scientific, if they want to do what we do in scientific medicine, then what they have to do is take the product away and experience it. And what happens is the vast majority of people will come back to me and then tell me what they think. And what they think is that these are incredible products that work wonderfully well. And I've certainly been able to help a lot more people in a lot more ways than I could ever imagine before, not through just the products, but through this entire opportunity.
I'm a cardiovascular surgeon, and my wife and I make a ton of money, and I didn't have much of a life. And looking into the future, it didn't seem like any of that was really going to change very much. And I love cardiac surgery. I love doing cardiac surgery. And so that wasn't the problem. Last night when this conference first started, we had some pictures on the screen, and one of the pictures was that of the space shuttle taking off. And the symbolism of a space shuttle taking off and the star rising was, very obvious about Nikken. But I looked around the audience, and what happened was everybody was raptured. And they weren't raptured because we were taking a human being and put him in a metal can up into space that has no life in it. They were enraptured because of the challenge and the pride and humans being more into space. And that's kind of what this is really all about. Now, having said that, I got into Nikken because I wanted to sleep better. And in fact, the products work fine, and I am sleeping better. But what I'm finding is that I'm staying into Nikken because of all the evolving reasons that I have as time goes by. And those reasons are changing as I learn more and I see more of what these products can do. One of the most commonly asked questions for me is, are there any contraindications to these products, particularly in the face of cardiac patients? Well, there are two specific contraindications that I'm aware of. One are pacemakers, and the other is defibrillators, which is a type of machine that electrically shocks the heart that goes into an evil rhythm. The question we really have to ask is stress, poor nutrition, poor sleep really a common pathway towards the end result of a lot of disease states? Why does one person have the same heart disease as another? He goes on to have a heart attack, the first person doesn't. A lot of time, they're happier, there's less stress, they're sleeping better. I think these products are for everybody unless there's a specific contraindication.
Because I run a pain clinic, I've already incorporated some relatively non-traditional methods into my practice because I have so many patients that have fallen through the cracks everywhere else. My typical patient had already seen about 10 other physicians before they ended up on my doorstep, and if traditional therapy had been effective, they never would have ended up in my office. Because of that, I was kind of actively looking for alternatives in my practice. As my husband said, he got the products worked wonderfully for us. So I started incorporating them into my practice and initially kind of experimenting to see what I'd find with my patients. At this point, I've used these products with hundreds and hundreds of patients with what I think are near miraculous results in many cases, often with people where I had nothing to offer them in standard medicine. As a business, I decided that I would really enjoy the opportunity that it gave me to actually teach my patients other ways that they could make their lives to work as well. Probably most often I get asked about how I can incorporate these into my practice and how that fits with standard medicine. I use these as an additional modality within my practice, and I talk to patients about them as an option, another way that they can look at maybe helping themselves to feel better. In many ways, it has allowed me to reconnect with my patients despite managed care and mandatory co-payments that keep getting in the middle of the relationship I have with my patients. And this has allowed me to spend more time talking to them, to practice medicine they want to, and help them find other ways to heal themselves.
Well, I'll tell you, as a physician, if you look at these products from the outside in, from what we were trained and what we've done for the last 20 years before we got involved in this company, they wouldn't make much sense to us. And with that, there's a change in consciousness. What started me in this was my wife. My wife had a very severe accident and was involved in the point where, after a year of having her back worked on by two of my partners who are pain specialists, I'm in the Department of Anesthesia, and then after that, having other types of medicines causing problems, including having to have more medicines to take care of the medicines, she resolved to basically sit and just suffer. Within 10 days of using the products, I watched my wife have 80% recovery, and over the next 30 to 60 days have 100% recovery. Her life was given back to her. I looked around and realized, as a physician, I had a moral consciousness not only to embrace these, but then to go out and carry the banner. Since that time, thank you. I believe now, as I sit here, the question that's asked me, when will the medical community embrace Nikken and what we're doing? Well, I will tell you, my friends, that they already have. As I look here, I see six, I can't count, 5 of my other colleagues, 6 actually with Dr. Boger, and we are embracing it. Our numbers are growing daily. We have over 40 healthcare professionals here from Dayton, Ohio today, and we're very proud of them. In January, the medical community started really taking a look at what we're doing. We have star athletes saying how great they are, and those are gentlemen whose performance is dependent on being healthy. In January, the American Journal of Pain Management came out with an article. Then it was a small study, but in there was an opinion letter. And in that opinion letter, they made notification that neuromagnetics, that the onset of preventive health care, is the wave of the future. And I believe that you sitting here today and the physicians that look at this and the healthcare professionals have an obligation to embrace it, to include it. If you get hit by a car, God help you, we have the technology to take care of it, and we do it better here in North America than anywhere else in the world. But if you have a chronic disease state, we don't have the answers, and we're in search of those, and I believe, ladies and gentlemen, that we have found those answers. Thank you.
I'd like to conclude with a few comments. I'd like to read from you an excerpt from this article entitled, "The Doctor is Not In," on the managed failure of managed care. 2,300 Massachusetts physicians in December of last year signed a despairing manifesto in the Journal of the American Medical Association. And I quote, "The time we are allowed to spend with the sick shrinks under the pressure to increase throughput, as though we were dealing with industrial commodities rather than afflicted human beings. Physicians and nurses are being prodded by threats and bribes to abdicate allegiance to patients and to shun the sickest, who may be unprofitable. Some of us risk being fired or delisted, forgiven, or even discussing expensive services, and many are offered bonuses for minimizing care. Ladies and gentlemen, this manifesto points only in one direction. And that direction is that we need to move toward prevention in the world on a global basis. I'd like you to join me in showing your appreciation to these physicians who represent the pioneers of the new wellness as we move into the new millennium. Ladies and gentlemen, I present to you the doctors panel. Thank you very much.